Hello everyone, this is Pratik Vyas. I am final year medical student at GMC Dungarpur. In this current time, there are so many diseases which doesn't have any specific treatment. In last years, we already faced the COVID-19 pandemic, and now again a viral disease becomes a global emergency, and we all know that is monkeypox viral disease. So in this video, we are going to cover all the details about monkeypox which are needed. Okay. WHO declares rapidly spreading monkeypox outbreak a global health emergency. There have been more than 16,000 cases in 75 countries are reported. The WHO declared its global health emergency on 23rd July 2022. Okay. WHO last issued a global health emergency in January 2020 in response to the COVID-19. Okay. WHO chief also state that men who having sex with the men, the community are at the highest risk, and the risk is moderate globally, but it is higher in the European countries. Okay. In recent times, the case fatality ratio has been around 3 to 6%, but in European countries, it is around 10 to 11%. Okay. So which is very higher side. Monkeypox is a viral zoonosis. It is transmitted human from the animals and having symptoms similar to the smallpox patient, but the smallpox symptoms are much higher. In aspect of microbiology, the monkeypox virus is a enveloped double-stranded DNA virus which belongs to orthopox virus genus of the Poxviridae family, and having two distinct genetic clades. The first is Central African and West African. Central African, also known as Congo Basin clade. Mode of transmission. It has main three mode of transmission. First is animal to human, second was human to human, and third is placental transmission also. Okay. Genetic transmission, it comes from animal, so it occurs from direct contact with the blood, bodily fluid, and cutaneous or mucosal lesion of infected animal. The second one is human to human transmission, is which can result from the close contact with the respiratory secretions. Respiratory secretions are important. Skin lesions of an affected person is important, and the contaminated objected. Okay. Or placental transmission, which can lead to congenital monkeypox. Okay. So health workers and household members who are close contact to active cases are at greater risk. Other, because it is a zoonotic condition. Okay. So eating inadequately cooked meat and other animal products of infected animal is possibly at higher risk. So what are the symptoms and signs? The incubation period is around 6 to 13 days, but it can range from 5 to 21 days. The infections can be divided into two periods. The first is invasion period and second is skin eruption period. Okay. So invasion period, which is last for 0 to 5 days, in which we can see the symptoms are fever, intense headache, lymphadenopathy, back pain, myalgia, and intense asthenia, the lack of energy. Okay. So in which the lymphadenopathy is important, because what is lymphadenopathy? The swelling of lymph nodes. Okay. So lymphadenopathy is a distinctive features from the other rash illnesses. Skin eruption, which is usually begin within 1 to 3 days of appearance of fever, and the rashes are more concentrated on the face and the extremities rather than trunk. Also, it can affect the mucosal area and oral mucosa, genitalia, and the conjunctiva, as well as cornea. Okay. Cornea is very important again. The rash involves the in sequential form from the macule to crust. Okay. So macule is flat, papule is slightly everted, slightly raised vesicle, it is clear fluid filled. Okay, clear fluid filled, or pustules, which is pus filled. Then crust, which dry up and fall off. The children's and immunocompromised patient are at higher risk. Now we're moving on the complication part. The complication is secondary infection, the respiratory distress, sepsis, encephalitis, GIT ulcer and symptoms, corneal infection, and loss of vision. Okay, so how can we diagnose it is a monkeypox? So clinically we have to differentiate from other rash illnesses like chickenpox, measles, bacterial infection, scabies, and syphilis, and allergy. Okay, allergy from medication. If we suspect it is a monkeypox, then we take sample. Okay, then we take sample which is not a blood sample. Okay, the sample is skin lesions. The roof and fluid from the vesicles can be pustule or any other dry crust which are there present. The sample should be stored in a dry, sterile tube. No viral transport media use. Okay, to diagnose correctly, the information should be provided with the specimen are the onset of fever, onset of rash, the specimen collection date, and the current stage of individual, that is stage of rashes, and age. These are some information which we should provided with the specimen to the laboratory person. Okay, and it's sent for the very famous PCR, polymerase chain reaction, because it's higher accuracy and sensitivity. It is important to know that viremia duration is very short. That's why the PCR blood tests are usually inconclusive. Okay, now moving to the treatment part. Monkeypox is usually self-limited disease which occurring for last 2 to 4 weeks. As such, there is no any specific treatment for this, so we treat the patient symptomatically and try to manage the complication. We use antibiotics and analgesics for fever and pain. First complication is secondary infection, which is treated by the antibiotics. Okay, and for respiratory distress, we always start non-invasive ventilation, oxygen supplementation. We also use steroids, and if there is need of tracheal intubation, then we go for it. For sepsis, antibiotics and IV fluids, mechanical ventilation again. For GI symptoms, we use antiemetics and antidiarrheal agents. For corneal infection, we use ocular antibiotics. Tecovirimat, it is an antiviral agent which is approved for treatment for monkeypox virus, but it is in clinical trial. It is used for 14 days in IV form and oral form. Okay. If the creatinine clearance is less than 30 ml per minute, it is contraindicated. It is sufficient to know about the treatment part, but it is not available in our India. That's why in India we use cidofovir. Okay, cidofovir and brincidofovir. These are another antiviral agents. Okay. Vaccine against smallpox, it is seen 85% effective for monkeypox virus, but the first generation vaccine is not available for general population. Okay, and another modified attenuated vaccinia virus based vaccine is approved for prevention of monkeypox in 2019, but it is for person who worked in laboratory. Okay, and how we prevent? By the awareness of risk factor and educating the people. Okay, so these are important for us. Thank you.